childbirth, abdominal weakness, diabetes, prostate problems. There's a long list of factors that can cause incontinence in women and men. There is help available. In fact, most cases can be cured or at least improved with proper diagnosis and treatment. Treatment that could be as easy as some exercises.
Incontinence is a subject that is very uncomfortable for people to talk about, even with their physicians or healthcare providers. It is a very widespread condition that many people, both men and women, are dealing with. The most common causes of incontinence are usually any trauma to pelvic floor muscles, and so for females that is vaginal deliveries and even pregnancy. Also menopause is a big factor for women. You lose some muscle mass with menopause. For men, what I'm finding is that men that have had prostate cancer and prostatectomy surgeries or their prostate removed are more likely to develop urinary incontinence. There are several different types of incontinence. Probably the most common is stress incontinence. Stress incontinence is any leakage of urine that is preceded by an increase of intra-abdominal pressure. Say a cough or a sneeze, lifting something heavy, jumping, things like that, all are forms of stress incontinence. Another type of incontinence is urge incontinence. And urge incontinence happens when there's a spasm to the bladder or some sort of dysfunction in the bladder that causes a strong, sudden urge to urinate, and before the person is able to get to a toilet, there's some urine leakage. There is a type of incontinence called mixed incontinence, which is a combination of both stress and urge incontinence. Physical therapy is considered a conservative treatment for urinary incontinence. And so what physical therapy entails is strengthening of the muscles of the pelvic floor. So the pelvic floor muscles help prevent both urinary and fecal continence, along with supporting of pelvic organs and that type of thing. So physical therapy really just deals with strengthening of the muscles, and there's several different ways to do that. Some common physical therapy treatments for incontinence include strengthening of the pelvic floor muscles, and that's by doing Kegel exercises. Kegel exercises are an active contraction of the pelvic floor. Other treatments are strengthening the muscles around the hips and pelvis, which are very close in proximity to pelvic floor, and you can actually get some carryover of some pelvic floor strength. Other approaches include relaxation techniques and bladder retraining exercises to help with more of that overactive bladder or urge incontinence. Aside from urinary incontinence, which is a pretty obvious problem that you're having, other things that I come in contact with are frequency and urgency. So urgency is a strong, sudden urge to use the bathroom. You've got to go right now. There's been some commercials on the past couple of years that advertise some medication for that, but that's a real problem where you just don't get any warning and all of a sudden you have to go to the restroom. So there's urgency, and then if you have leakage with that, that's the urge incontinence. Another problem is frequency, which it just means how often you're going to the bathroom or to the restroom to urinate. Normal frequency for 24 hours is anywhere between 4 and 6, even up to 8 times in 24 hours. Normal time for nighttime urination is 0 to 1, which means most of the time you're able to sleep through the night, a good solid 8 hours without having to get up, but occasionally you might have to get up to go once. So given that, a nighttime urination of 0 to 1, every 3 to 4 hours during the day is a normal urinary frequency, and that's really a signal of good bladder health as well. Unfortunately, it's not all cut and dry for everyone. Everyone doesn't get completely cured, but in 95% of the cases, physical therapy makes a big difference.
For more information about getting a program developed specifically for you by the Iowa Clinic Physical Therapy Department, call 515-875-9706.